Hi again. Let's continue this lecture on cranial bones, and we'll deal with the sphenoid bone in this lecture. So in this first slide, there are several views of the sphenoid bone, and they're all colored. So some of these views you should start recognizing. Some of them are easier than others. This one is not particularly easy to figure out what the heck you're looking at, but you're looking at the pterygoid processes. And this view shows in green a superior view of the cranial floor and sphenoid bone. And on the far right is an exploded view where the sutures have been digested, and the sphenoid bone is shown here, occipital bone, and these would be the what bones on the sides? Yeah, temporal bone. So we will get to it, but I'll point out now maybe something for you to mark on your slide so that you can come back to it. There are two little holes here. One's larger than the other, and we will be dealing with those. So it's just another view of two foramina that we'll study later. Next slide. Sphenoid again. The skull on the left shows what we were just looking at with the pink sphenoid. And here are those same two holes again, which we will be dealing with repeatedly. So at any rate, to the main illustration, or main figure in this slide is the sphenoid, and there are different parts of it that are just colored differently. So you have the body in blue, central part, and that would be the figure on the right would be more or less this area would make up the body. And then in green we have the lesser wings of the sphenoid, so they would be kind of over here. And then we have the greater wings of the sphenoid in brown, which would be for this area. You don't need to mark all this up on your slides. You'll get the hang of it. And then the yellow are the pterygoid processes that are descending inferiorly. You cannot see them in the view on the left. And there is a lateral and a medial plate. So these are the pterygoid processes. Okay, that's enough of that slide. Oh, backing up, these different foramina we will come back to. And there is your SOF again. Next slide. Inferior view, and here are the pterygoid processes again. And there is a lateral plate on the left, and there is a medial plate on the right, and there's a pterygoid fossa in between. So remember what bone the pterygoid processes are a feature of. So all of this discussion, this whole entire lecture segment is on the sphenoid bone. So everything that we're talking about is a feature of the sphenoid. And the pterygoid processes we will hang muscles on for mastication. Next slide. Again, talking about the sphenoid, so some of this is just simply review. So the shaded area showing the temporal fossa, but when we're talking about the sphenoid again, here are the pterygoid processes and the hamulus, and there's a lateral plate, a medial plate, and a fossa in between. Also shows the infratemporal crest again, which is part of the sphenoid, which we mentioned in an earlier lecture as the boundary line between the temporal fossa superiorly and the infratemporal fossa inferiorly. Next slide. Back to the same view of the sphenoid bone, and I put in the identification for the openings and what passes through them. So the foramen rotundum, we discussed that in an earlier lecture when we were talking about the infratemporal fossa and the pterygopalatine fossa. So this is the foramen rotundum, and what passes through it is the second branch of the fifth cranial nerve, or V2 as it's sometimes abbreviated. Passes through the foramen rotundum and enters the pterygopalatine fossa. We'll keep working on that. The larger hole, the oval shaped hole, is the foramen ovale, and through it is the third and final branch of the fifth cranial nerve, or the trigeminal nerve. And the last little hole in the sphenoid is this foramen spinosum, which is passage for the middle meningeal artery. We won't spend a lot of time on that. But these three foramina run sort of in a diagonal, more or less. So you have the foramen spinosum, foramen ovale, and foramen rotundum. So now you know how all three branches of the fifth cranial nerve exit the cranium. V1 exited through what? Right, the superior orbital fissure. V2 through foramen rotundum, V3 through foramen ovale. But you will work on that repeatedly. And just another view of those foramina. So the one that's easy to recognize is the large one, the foramen ovale, circle in red. And then there is the smaller one, the foramen spinosum. You know that these are all holes, passageways, foramina, within the sphenoid bone. And then we have the foramen rotundum here. So if we go through the foramen rotundum, where do we wind up? Back in the pterygopalatine fossa. And you can tell me what nerves and structures pass through those openings. Okay, next slide. More of same. This is a posterior view of the disarticulated sphenoid bone. Again, the easy one to recognize and get oriented with is the foramen ovale for V3. And then you have the foramen spinosum for the middle meningeal artery. And then we have the foramen rotundum for V2. Okay, next slide. Just repetition for a lot of this. The sphenoid bone is in yellow. Again, you can see the foramen spinosum and the foramen ovale. Read the note in the blue box bottom right. You cannot see the foramen rotundum from an inferior view here. It's only visible with a superior view, as we were just looking at previously. So if you're shown an inferior view, you cannot see the foramen rotundum. You have to go internal. Okay, so the spine of the sphenoid is a tiny little nibbin of bone, which is at the tip of the large black arrow. Difficult to see, almost impossible to appreciate on this view. The smaller view shows the spine of the sphenoid in discussion with the TMJ, the temporomandibular joint. So this illustration in the bottom left is out of your textbook in the TMJ chapter. But what I want to point out is this little piece of the sphenoid, which forms a little tiny spine of the sphenoid. The only reason I'm mentioning that is because we will hook a ligament up to it later when we discuss the TMJ, the sphenomandibular ligament. So it runs between the sphenoid bone and the mandible. Okay, next slide. Just review again. Infratemporal crest, part of the greater wing of the sphenoid bone. So this is the greater wing of sphenoid. And it's just sort of shown sort of like that along that suture. Okay, and so you remember the infratemporal crest, that line of demarcation between the infratemporal fossa and the temporal fossa. Next slide. We've seen this illustration again, and I'm just reviewing the infratemporal crest, just reminding you that it's part of the sphenoid. We've already been through this slide. You should be able to recognize again pretty much everything in this illustration. Next slide. Superior view again. And here I'm just pointing out the sella turcica. You probably studied this in A&P1 when you did the skeletal system. But the hypophyseal fossa is the depression which the pituitary gland sits in. And so that's all I want to point out in this view. So you should recognize the hypophyseal fossa and know that it's a part of the sphenoid bone. Okay. So there's other features in this figure that we will talk about, some of which we've already talked about, such as the internal acoustic meatus. I'm just sort of scanning through the list. And again, make sure that you can identify all these bones that are highlighted. Make sure that makes sense to you. We haven't done the ethmoid yet. Okay? So again, just spend some time looking at the slides. And another view of the part of the sphenoid in yellow, and it's showing the sphenoidal sinuses. So we talked about the frontal sinuses. Well, there are also sphenoid sinuses that make up part of the paranasal. The sagittal view, there's the hypophyseal fossa again. And then this box is asking you what those little black structures are here. And you would take a look at that, study it for a moment, and say, oh yeah, those are the frontal sinuses of the frontal bone. Okay, next slide. More of same. Just a moment here. Let's see where I'm at. Okay. So, pointing out the sphenoid sinus again. This portion, this illustration, you should spend a little bit of time getting used to. We're going to look at it more when we talk about facial bones. But this region is here. And this figure on top is showing the bony nasal septum. And that bony nasal septum has been removed on the lower figure. And then you're looking at some facial bones. Something I might point out here is the sphenopalatine foramen again. So there's the little hole that the label is identifying. And if you go through that hole, notice that we're in the nasal cavity. If we go the other way, if we go from the nasal cavity out the foramen rotundum, where would we wind up? Leave the nasal cavity, go through the foramen rotundum. When you go through that foramen, where are you? Right, you're back into the pterygopalatine fossa. Keep working on it. Keep reviewing that. Next slide. Here we're looking at an anterior view of the disarticulated sphenoid bone. So anterior to the sphenoid is the ethmoid bone that we haven't talked about. But here is an anterior view of the openings into the sphenoid sinuses. This is the body of the sphenoid again. So there's more or less the body. It sort of looks like a giant hornet flying at you. Legs, which are the pterygoid processes, and then the wings. And here is the foramen rotundum. Takes a little while to get used to what you're looking at, but it's an anterior view. So here is the labels are a little bit fuzzy, but this is the SOF. And you know what passes through the SOF? Which nerves? Okay, next slide. Oh, we're done. That was the last slide for the sphenoid. So, time for lunch. And we'll be back again soon to pick up with the ethmoid.